Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Adalizra binti Azmi, and now I will explain about the PACEMAN for the epi shoulder projections. As you can see, here is the radiograph of epi projections of the shoulder. This is because the acromial process, glenoid fossa, and humerus can be visualized clearly. Next, for the positioning, there is no rotations evident by glenoid cavity is visible. Lateral scapula situated more anteriorly than medial scapula. Next, clavicle slightly elevated but not foreshortening. And the last one, patient's arms in the external rotations is evident by greater tubercle and humeral head is in profile. Besides, cortical outline of the laser tubercle is between greater tubercle and humeral head. Third, for the alignment. Alignment between astrotube and cassette is incorrect, evident by the gap between superior and inferior border is unequal distance. Next, the alignment between patient part and the cassette is correct, evident by the center of the cassette is aligned with the center of the part. And the last one, the alignment between astrotube and patient part is incorrect, evident by the center of the astrotube is not aligned with the center of the part. To correct this, adjust the astrotube superiorly until the center of the tube is aligned with the center of the part. The standard centering point for this projection is 2.5 cm inferior to coracoid process. For the collimations, at the superior border, structure that should be included is the acromial process and clavicle. At the lateral border, structure that should be included is the lateral skin margin. And the last one, for the inferior border, the structure should be included is the 1/3 of the humerus. For the exposure factor, the KVP used is adequate for the penetrations and radiographic contrast. It's evident by the bony cortical outline of the thick structure, which is acromion, and the bony cortical outline for the thin structure, which is glenoid fossa, can be seen clearly. And also for the MAS, also adequate for the detail and density, is evident by the bony trabecular pattern for the thick structure, which is acromion, and the bony trabecular pattern for the thin structure, which is glenoid fossa, can be seen clearly. Thus, no change for the KVP and MAS. There is no presence of the anatomical structure seen on the radiograph. The marker should be placed at the top of the shoulder and out from the regions of interest. For the aesthetic, the film size used is 24 x 30 cm, which is suitable for demonstrating all structure of interest. The patient's names and ID, date of the examinations, and place for examinations are not present in the radiograph. It should be placed at the right side of the superior border.